Breaking the silence. Hello everyone, welcome back. Today we're going to dive into a subject that is often overlooked, often misunderstood, and for many women, quietly painful. Female sexual apathy, also known in the medical field as hypoactive sexual desire disorder. Now, if you are a woman who has ever felt like your desire for intimacy just disappeared, or if you've wondered why you're not in the mood the way you used to be, please know you are not alone. Studies suggest that up to 1 in 3 women will experience some form of low sexual desire during their lifetime. Yet, because of cultural taboos and stigma, many women never talk about it, never seek help, and quietly carry the burden. Today, as both a doctor and researcher, I want to unpack this topic in detail. We will look at what sexual apathy really is, the medical and psychological factors behind it, and most importantly, I'll share small practical tips, everyday strategies you can apply to begin improving intimacy, confidence, and connection. This is not just about sex, it's about quality of life, emotional well-being, relationships, and self-esteem. So, grab a cup of tea, relax, and let's explore this together. Part 1. Understanding female sexual apathy. What is it really? Sexual apathy, or hypoactive sexual desire disorder, isn't simply not wanting sex. It's when low desire becomes persistent, causes distress, and affects well-being or relationships. It's not about morality, it's not about being cold, and it's not about a woman being less feminine. It is a medical and psychological condition that can be influenced by multiple factors. The science behind desire. Sexual desire is actually one of the most complex human experiences. It's not controlled by just one hormone or one thought. It's a dynamic interaction of the brain, body, emotions, and environment. Think of it like a recipe. Hormones such as estrogen, testosterone, and oxytocin are the spices. The nervous system and blood flow are the cooking method. Emotional connection and trust with a partner are the base ingredients. And stress, lifestyle, and cultural beliefs are like the kitchen environment. They can make or break the final dish. When something is off in any of these areas, the recipe of desire doesn't quite come together. Part 2. Common causes. 1. Hormonal shifts. Postpartum period. After childbirth, estrogen drops and prolactin rises, leading to natural suppression of sexual desire. Combine that with fatigue and childcare stress, and desire often takes a back seat. Menopause. Declining estrogen and testosterone can reduce vaginal lubrication, cause pain during sex, and lower libido. Hormonal contraception. For some women, birth control pills may lower circulating testosterone, affecting arousal. 2. Psychological and emotional factors. Chronic stress releases cortisol, a hormone that suppresses sexual arousal. Past trauma or negative sexual experiences can resurface and shut down desire. Anxiety, depression, or low self-esteem often translate into reduced intimacy. 3. Relationship dynamics. Resentment, unresolved conflict, or lack of communication can silently erode desire. A monotonous routine in long-term relationships sometimes dulls passion if couples don't actively nurture intimacy. 4. Lifestyle and health factors. Lack of sleep, poor diet, minimal physical activity, and excessive alcohol or smoking all affect hormone balance and energy. Chronic illnesses such as diabetes, thyroid disease, or heart conditions may also reduce sexual drive. Part 3. Why it matters. Some may ask, why is this important? Isn't sex just one part of life? Yes, but sexual well-being is deeply tied to overall well-being. Women who struggle with sexual apathy often report lower self-confidence, greater relationship strain, feelings of guilt, shame, or not being normal, even worsening anxiety or depression. Addressing sexual apathy is not about chasing a Hollywood version of passion. It's about restoring balance, intimacy, and personal fulfillment. Part 4. Tips and small steps to improve. Now let's get to the heart of the matter. What can women do, practically, realistically, to start improving sexual apathy? I'll break this down into 10 key strategies, each with actionable steps.
1. Reconnect with your own body. Before intimacy with a partner, intimacy with yourself matters. Many women disconnect from their own bodies due to shame, exhaustion, or criticism. Practical tip: spend 10 minutes daily on body awareness. Simple stretches, mindful breathing, or even gentle self-touch that isn't sexual but nurturing. This helps the nervous system shift from stress mode to relaxation mode, a prerequisite for desire. 2. Prioritize quality sleep. Desire requires energy, and exhaustion is the #1 killer of libido. Practical tip: aim for at least 7 hours of consistent, restful sleep. Reduce screen time before bed and try relaxation rituals like herbal tea or warm baths. 3. Nutrition that fuels hormones. Food is not just calories, it's chemistry. Certain nutrients directly support sexual health. Practical tip: include omega-3 fatty acids, salmon, walnuts, and zinc, pumpkin seeds or oysters, and vitamin D. Reduce excessive sugar and alcohol, both of which destabilize hormones. 4. Exercise as a libido booster. Regular physical activity increases circulation, balances hormones, and boosts confidence. Practical tip: try yoga or Pilates, which improve blood flow to the pelvic region. Even 20 minutes of brisk walking daily can release endorphins that prime the body for intimacy. 5. Communication with your partner. Desire does not grow in silence. Talking openly about needs, frustrations, and fantasies creates a safe emotional space. Practical tip: use I statements instead of blame, like "I feel disconnected when we don't touch outside the bedroom." Schedule connection time without distractions, even if not sexual. 6. Reduce stress deliberately. High stress means high cortisol, which suppresses sexual desire. Practical tip: try mindfulness meditation for 10 minutes daily. Engage in hobbies or creative activities that bring joy. 7. Explore sensate focus exercises. These are guided, non-demand touching practices developed by sex therapists. The goal is to rediscover touch without pressure for performance. Practical tip: start with a partner agreement. No intercourse, just gentle exploration of each other's skin, hands, or hair. Slowly rebuild comfort and desire. 8. Consider professional help. Sometimes apathy has deeper medical or psychological roots. Practical tip: consult a gynecologist or endocrinologist for hormonal assessment. A sex therapist or counselor can help address relationship dynamics or past trauma.
9. Embrace novelty. The brain thrives on newness. Novelty triggers dopamine, the anticipation chemical. Practical tip: try a new setting for intimacy, a weekend getaway, a different room, or even changing lighting and music. Introduce playful activities that aren't focused only on sex. 10. Self-compassion and patience. Most importantly, healing desire takes time. Be gentle with yourself. Practical tip: replace critical thoughts like "I'm broken" with affirmations like "I'm learning to reconnect with my body." Celebrate small progress, not perfection. Part 5. Myths versus truths. Let's quickly address some common myths. Myth: low desire means you don't love your partner. Truth: desire fluctuates due to biology, stress, and health, not just love. Myth: this is just a normal part of aging. Truth. While hormones shift, desire can absolutely be maintained with support. Myth. If you really try, it will fix itself. Truth. This is a medical and psychological condition. Professional help is valid and often necessary. Conclusion. Restoring intimacy and joy. So let's bring it all together. Female sexual apathy is not a character flaw. It's not shameful. It is a multifaceted health condition that deserves compassion, understanding, and practical support. If you or someone you know is experiencing this, remember, small, consistent steps, improving sleep, nutrition, stress management, communication, and body awareness can gradually reignite desire. And when necessary, professional guidance is available and effective. The goal is not simply more sex. It's about more connection, vitality, and confidence in your life. Thank you for spending this time with me today. If you found this helpful, share it with someone who might need to hear these words. And remember, taking care of your sexual health is taking care of your overall health.